Good. I'm Nicola, and I am your trichologist. Welcome to the Hair and Scalp Clinic. It's great to meet you. Can I just take your full name? Thank you. And your date of birth? Thanks. So, my love, I have you in for a consultation today and a hair and scalp examination. Is that correct? Good. Just checking I have you in for the right thing. So you are a new patient here. Thank you for coming to see us. Okay, so if I believe correctly, you're experiencing hair loss. Okay. How long have you been experiencing that? Okay. So quite some time. Okay, so you said about a year, and that's when you noticed it started to go brittle. Okay, so split ends, dry, brittle. Okay, that's about a year ago. All right, and what did you notice then? In the shower. So were you finding it's come out in clumps, or would you say it's just little bits here and there? Okay. Right. Yep, that makes sense. All right. So, have you seen any patches on your scalp at all? Okay. When did those appear? Okay, so you had started to see them about 6 months ago. Okay. How many do you have that you're aware of? I know it's a little bit difficult, isn't it, trying to see your own head, but has anybody had a look for you? Okay. Don't worry, I'll have a good look anyway. All right. You've seen your general practitioner, and what did they say to you? Okay, so they think you're experiencing alopecia. Yep, I would say it does sound like that, but we obviously have to have a good assessment just to, you know, rule out things and give you an accurate diagnosis. Okay, so we are medically trained, but we're not medically qualified. Okay, so obviously I'm going to do a thorough examination on your hair, on your scalp, and then I can give you a diagnosis, and we do have treatment here and offer different techniques that we can do to help. Okay, but if I feel that, you know, you need something a bit more advanced, and if you want to, then I can actually refer you on to a dermatologist. Okay, and they'll be able to, you know, assist in other ways. All right, but I'm a good starting point, and we do have a lot of effective treatment here. All right, my love. Yeah, so don't worry. Okay, so I mean, just having a brief look at your hair, it does look quite dry. All right, what shampoo products do you use? Okay, so you switched over to SP again from Olaplex, was it? And how long were you using the Olaplex? Right, so that's quite a long time, so your hair may have got kind of used to it. When did you switch back to the SP? Not too long ago, okay, so about 2 months. Have you noticed a change? Okay, so that's an improvement. All right, that's a good thing. Okay, so stick with that. And I'm glad that you don't use any cheap products and things like that. That is a really good brand, and we do kind of specialise in some Olaplex treatments and products, as well as the SP Wella ranges. All right, so I do like those. We do Nixons and stuff like that as well. We've got Sun's products and a few more, you know, medicated products and things like that. Okay, but obviously we can't go too advanced because that isn't our area. All right, yes. So that's fine. Okay, so I understand your hair issues. Do you dye your hair at all? Okay. Right, and how often do you go to the hairdressers? Okay, it's about every 5 weeks. Okay. And would you have the same done every time? Okay. That's fine. Wonderful. Any problems with your scalp at all? Any itching, any dryness, any dandruff, flaking or anything like that? Okay, well that's good. So your scalp is okay. I will obviously assess the scalp, especially with the patches. That's really important for me to have a look. All right. Okay. So obviously, there's all sorts of different reasons why we lose our hair. If you look at my poster here, it shows you briefly some different types of alopecia. All right. So you get your ones that are caused through hormonal imbalances, ones through immune issues, stress through childbirth, radiation, chemotherapy, etc. Okay, my love. Yeah. So the most common is the androgenetic alopecia. Now that is also known as pattern baldness. So you can get male pattern baldness, also female pattern baldness. Okay. It is more common in men, but women can experience it too. All right, so usually at a more mature age, if the ladies are in the menopause, that's when they may experience this pattern baldness. All right, it usually is genetic, so it is passed down, hence the name. Okay, but just because somebody in your family has it doesn't mean you're going to get it. All right, exactly that. So it is more common, which is why some ladies do like to go on HRT, just to also prevent hair loss. And it's really important that you do actually maintain your scalp and hair throughout, obviously, its life, just to help, obviously, keep your hair intact. All right. Yeah, exactly. That is quite common, and you'll find that you get thinning to the front and the crown, which we call the Ludwig pattern. And if you have a little look at this poster here, it will show you a little bit about what can happen. But just by briefly looking at you, I can't see that. All right, which is good. Okay, so you'll find that when people are pregnant or starting puberty, that's when this can happen. It's usually temporary, but there is stages where it is permanent. All right, and then if your follicles close up, it stops producing, there's poor circulation there, it's not going to start growing. All right, so it's a mixture of all sorts of things. Yeah. The other one is alopecia areata, which is patches of different sizes, and they can join together and then cause a big extensive patch on the scalp. Okay, yeah, and that is usually permanent because follicles forget how to produce hair, which is a little bit like with the pattern baldness, but we can stimulate that and get them to grow. All right, but I'll explain all that later. Okay, does that all make sense to you? Okay, I know I've just filled you with a little bit of information, but it is quite useful to know about these things. Yeah, exactly. So I've touched on the two. From what we've spoken about, I would say it's either or. Okay. Yeah, I mean, you could sort of get both, but usually if it's the pattern baldness, the patches are just, included in that. Yeah. So, can you just tell me if you have any illnesses? Mm-hmm. Okay. Brilliant. And how is all that is all managed? Okay. Great. Are you allergic to anything at all? And are you on any medication? Okay. Great, and you're all controlled on those, everything's fine. How long have you been on these? Because sometimes medication can have an impact. Okay, it shouldn't be that then, that's quite a long time, isn't it? So that's good. All right, my love. So do you drink or smoke excessively or at all? Smoking in general and drinking doesn't necessarily have an impact, but it's just the excessive amounts it can. Yeah. How is your sleep? How many hours do you get a night? Would you say it's quite disturbed? Are you restless? Do you ever wake up feeling refreshed or not? Yep, believe it or not, poor sleep can have an impact. What about your stress levels? I know our stress levels go up and down because that's life, but what would you say? About a year ago, did you have any particular stress or anything like that? Okay. Interesting. Well, that could be it. Yeah, that could have triggered it off. Do you have anyone in your family with it? Okay, so your grandfather and that. Okay, anybody else? No, okay. Right, possibility could come down the line slightly, but more than likely we'll go to a male in your family. Okay. But the stress could have triggered it off. If we're talking about the pattern baldness, even the other one. All right. Okay. And how would you rate your stress at the moment? How do you think it is? Are you all right? Okay, but that's good that there's no stresses in your life. But I'm guessing this is stressing you out, isn't it? Yeah, that's a vicious circle then. Okay. Wonderful. Have you tried anything at all? Okay, so in salon treatments, okay. That's going to work more on probably your hair being brittle and things like that. So you have hair breakage, hair snapping, split ends, hair thinning, dry and damaged hair, brittle hair, porous hair, I don't know, and not growing. Okay, that's fine. So a little bit of everything there. Yeah, definitely. So we've definitely got an issue with the hair itself. Yeah, I mean, it could well be due to all that, it's having an impact and then causing alopecia as well. So kind of work hand in hand, really. Okay, it's quite complex when it comes to the hair, you know. Yeah, definitely. All sorts of things can impact. Is there anything you would like to tell me? Okay, that's fine. Okay, so when just done the hair, what you're experiencing, I know what products you were using, what you swapped to. That's good. Explained the two types of alopecias which I think you're experiencing. And just want to know if you have caffeine and how much. And what would you say your diet's like? Is it balanced? Is it poor? Is it okay? I guess it could be better. Okay. What kind of things do you eat in a day? What about in between? And is that every day? Okay. What kind of things do you drink? Okay, that's fine. Right, so we have all those questions done. I will need you to have a blood test done. Okay. Send you through to the nurse for that, okay. And that's just going to see if you're lacking anything. So any vitamins, minerals and things like that. Sometimes if we are lacking certain things, that's when I can start to go zinc, and you've got iron, vitamin D and things like that. Okay, that all can impact. So it's really good to check out your levels and your hormone levels and all sorts of things like that. There's a lot of things that I will be checking. Okay, yeah, great. So then, do you have any circulation issues that you're aware of? Okay, sometimes we have poor circulation in our scalp and that can impact. Okay, perfect. So that's all the questions done. I'm now going to examine your hair and scalp. I'm going to pop on some gloves and then I'm going to give your hair a nice brush and start the assessment. Okay, great. Excellent. Am I all right to begin? Okay. Have you always had thick hair? Okay. So it's looking quite thin. So this is quite a newer thing. Not got too much of a bad length, which is, you know, great. It does appear that you do have quite excessive split ends. Yeah. So I'm guessing you do have a lot of breakage, meaning it's probably not going to grow much. Are you finding that that's kind of the level you're always at? And you're finding it quite choppy, uneven. Okay, that's probably because it's breaking off in different positions. Yeah. You know, different areas are snapping and breaking, and then obviously you've got different areas falling out. So that's going to kind of cause that uneven texture, if you like. I'm just going to use my other comb. Do you find it gets quite static like? Mm. And the humidity is not going to help that. Especially at the moment, it's very warm, isn't it? Quite humid as well. See, if we cut it about there, it will look great, but then I bet that will start deteriorating as well. Looks very dry. If I go like that, it's lots of split ends all the way through your hair. I mean, I recommend that you probably cut it shorter for a bit. And I know that's not probably what you want to hear when you're experiencing hair loss, but I'm thinking if we bring it up, you know, a good few inches, I think that might help a little bit with the split ends. Because you're just taking off a few little bits and then you're left with it. I mean, look at that. This is kind of stuck, but these have snapped. Now this is obviously fairly recent. Yeah. Let's see where it's all snapped, look. It's alright, don't worry. Okay, we'll sort it out. And after you've had your blood test today, check your levels, but I recommend that you start taking some multivitamins and minerals and omega-3, 6 and 9. Okay, yeah. And then I think you should take some extra supplements, and I need you to be taking some biotin. Okay, just a good dose of that. I can give you some of that. It's quite a strong dose. Okay, especially for hair. Helps hair growth and things like that. Promote it. All right, especially where you've got your hair that's fallen out. Yeah. Yeah, any vitamins and minerals is perfectly fine. Okay. You may want to start taking some extra vitamin D rather than just the standard that you get. Yeah, I mean, obviously I don't know your vitamin D levels, but I think that's really going to help. It's about just trying anything at the moment, you know. Yeah. Okay. I can imagine, I know. Don't worry, honestly, it's fine. I know. All right. Okay. Let's deep breaths. It's okay. Honestly, I see it all the time. You know, people get upset about it, men and women. Yeah. And it can be very hard. But don't worry. Some tissues on the side, and I deliberately put tissues there because I know people get upset. But I'm going to try my hardest to help get your head sorted. Alright. Okay. Alright. Sorry, you just let it out. Shh, shh, shh. It's okay. It's alright. Okay. Do you want to carry on? Or okay. Your hair's got so much potential. Yeah. Okay. And just going to have a look at hair root. I will have to pull some hair in a while as well. We'll just see what happens when I pull, okay? I want to see if we've got weak hair at the roots. Okay, I'm now going to pull. Great. Good, because it feels quite strong when I pull, which is what I wanted to see. Just feeling the follicles. The middle section is all right. But like I said, any alopecia can be permanent, some of it, you know, temporary. Yeah, sometimes you just need to kickstart these follicles into action, you know. Yeah, definitely your parting is really good. Happy about that. Looks like all your follicles are doing as they should here, so that's promising. I'm just going to have a look through this section. Okay, so a little bit here, you can see a little patch. I don't know whether you've noticed this one. Okay, well, it's only small, so don't worry. Okay, you won't notice that. Okay, so look here. Yeah, I can see a patch there. Again, it's fairly small, so that's a good thing. Just having a look. Yeah, it would seem that the follicles are quite closed. Yeah. And there's a patch. Again, small, but it is looking exactly the same. That follicles have gone a bit dormant. Right, I'm just going to go around and look at the rest of your scalp. So let's have a look around here. Yeah, we can see a big patch here at the back. It's quite a large patch, that one. Yeah, is that the one that you've seen the most? Does this one just keep getting bigger and bigger? Okay. Yeah. It's definitely not closed follicles here. So basically the hair's fallen out completely, right from the root, and it hasn't grown back, so we do all experience some hair loss during a month. It's a normal cycle, okay? But what's happened to yours, it's been falling out and not growing back. And then the follicles have been closing up. There we go, I can see that there too. So it is sort of around your crown, kind of lowered down. I think we're experiencing a little bit of both, to be honest. That's quite, can happen. I mean, in general, your scalp looks fairly healthy, you know. Can't see any dandruff, no psoriasis or anything like that. And your scalp doesn't look particularly dry either, which is good. Let's have a look here. Yeah, it continues on. So when I comb through your hair, you're not getting a great deal come through the brush, which is great. So it's not necessarily snapping, you're just getting the usual amount which you'd expect when you brush your hair. Yeah, I just thought we were experiencing a little bit of dryness there. I think that's more of a build-up actually of shampoo. Just make sure you're washing your hair thoroughly. Put a decent amount of product on, but not overload it. And then make sure you're rinsing it properly. If you think it's done, you probably need a little bit longer. You can try not to dry your hair with a towel, as in a rough way. It's a heat protective spray when you straighten your hair. Hair dry on a medium setting, and always blast with cold before you're done. Yeah, I continue using the dark oil. Yes, and the perfect split ends. It's a good idea. And then I'd say use hydrating shampoo and repair conditioner. Okay. Oh, good. I'm glad they said the same. There's no lesions or cuts or anything on your scalp, no lumps or bumps, which is really good. Yeah, I can see it right there, so it's worse around the back. just going to come round and just do my other checks. Feeling all right? Good. So get some hair. Do you find your hair often gets knotty? I can see that. Yeah, it's gone as I expected. Okay, definitely the same now. Okay, it's quite static. Okay. Yeah, okay. Okay, my love. So, you definitely have alopecia. All right. I suspect you are suffering a little bit with pattern baldness. Okay, just because of whereabouts it is around the crown of the back. Okay, but because there is a couple of other patches, I feel like you may be experiencing alopecia areata as well. All right, but it could well be from that. Okay, so where are we at? I'll write all this up in a report for you. Okay. So we can do some UV light treatment. Okay. So what that will do, it causes an autoimmune response. Okay. So basically, it like massages the scalp, if you like. Okay. I would definitely recommend that we need to carry out some massage treatments on your head, okay, so on your scalp. So we need to try and get the circulation better, okay, we need to stimulate those follicles, okay, make them want to grow, okay, and you can use stuff like this to massage our hair, okay, in the shower. That'd be good. Pop a mask on and, you know, do that. Really good. And you want to really get it on the scalp. You want to stimulate it, okay. Yes, exactly. You could get something like this, but you'll find, as you can see, your hair goes quite static. But this would be good to just stimulate around the scalp. Okay. I would suggest a jade roller. Okay, and when you apply products, you roll it on there. Some people say it has holistic, healing, and some people swear by that alone. And you want to just roll it on different ways, and obviously it's best just to apply to the affected area. Okay, exactly. So I'm going to start you off. You need the vitamins. I'll just jot that down. So I will obviously get you to have a blood test before you go. We need to start the vitamin and minerals. The omegas 3, 6 and 9. Possibly vitamin D separately. Okay. Biotin separately. Okay. Obviously, once I've checked all the levels that I need to check, if there's anything else that I recommend that you take as well and do, then I will let you know that, don't worry. Okay. Yeah. And I want you to continue with your SP range. And make sure that you are washing it off properly. Give your head a nice good massage when you're washing your hair, okay? Good massage, and possibly a scalp massager like I've shown you, but you can also get some really funky ones with little looks like little ones of these like patches, and you go like this. Those little things rotate. Definitely recommend something like that. Regular scalp massages at the salon if you want to go to do that, Indian head massage or something like that, and get them to use a nice nourishing oil, preferably something like almond oil. All right, and you could also get them to pop in some essential oils like lavender or something like that. Obviously it'll help relax you, but it's obviously good for the scalp as well. Okay. I will send all this in an email, don't worry. Okay. So the shampoo, let me show you. This is the shampoo. So it's got saw, palmetto and argan oil in it. Okay. So when you apply this, I want you to give it a really good massage into your scalp. Okay, then leave it on and then rinse it off. It's got all the instructions in there, so you'll be, find it easy to do. Then I want to give you this. This is minoxidil, and this I want to spray onto the patches and then give it a really good massage. Okay, and that will soak its way in, and this is going to help open up the follicles. All right, and obviously all the massage and everything you're doing is really going to help stimulate. All right, but obviously there's instructions in here on what to do. I'm going to give you these special biotin tablets. Okay, it's a bit more concentrated for you than the ones you buy off the counter. All right. Okay, so I'm going to give you this product as well. So it has the minoxidil in it as well, and it also has a product called finasteride. Okay, and this can come also in capsule form. So the finasteride can come in capsules, okay, but with the capsules they're a little bit stronger, and that can often give you side effects and things like that, and we want to try and minimise side effects as much as possible. So I like to start people on this. This is great. It has both in there. Again, you want to spray it on the affected areas and massage it in. All right, now what I would suggest, shampoo, then twice a day, morning and night, you need to apply the minoxidil, massage it in, use your jade roller, something like that. Then apply this product, the 2-in-1. This has a really strong smell. Spritz it on, give it a good massage, jade roller it, leave it. Let it soak into your scalp, and I need you to do that twice a day on the affected areas. You might be better off getting somebody to do it for you, especially because it's a couple of patches and then there. All right, make sure you wash your hands and your rollers afterwards, okay? But yeah, then the products I want you to start on, and obviously the biotin, okay, and your multivitamins and minerals, okay. So let me just jot that down. Yeah, at a later date we could try just the capsule form if you wanted to give that a go. Yeah, you can use both at the same time. All right, we'll see how you get on. Don't want to overload you too much, okay? Wonderful, I'm happy with that. So I'm going to write all this up and I'm going to get those done for you while you're in your blood test. My lovely assistant will come and put those products up for you. Okay. All the instructions. And I'm going to put you on these, and I would like to see you in 4 weeks. Now, all this treatment, sometimes, you know, we're looking at least 6 months before we notice a huge difference, potentially 8 months. But you'll find 9 times out of 10, people start getting regrowth very fast. Okay, yes. This is brilliant treatment for pattern baldness. Okay. And then I think with the vitamins and the minerals, you know, trying to make your diet a bit more balanced, get more fluid into your water, less caffeine and things like that, okay? That's really going to help. Regular scalp massages. Yep, getting yourself some massages and just sit there randomly, you know, giving yourself good massages. Very relaxing as well. Exactly, so you can do that. And then stick with your SP range and just alternate like I suggested, okay? But the more you use that shampoo, the better, okay? And make sure you obviously are putting products on your hair, such as your split end things, etc. Okay? And like I said, we can look down the line of using UV treatment and different things like that. But as soon as I know more on your bloods, that would be a lot more helpful for me. Okay. And I definitely recommend that you try something like this. This is hair wax, okay? So it's moisturising and styling. You only need a small amount. So your little bits that are sticking up here from where it's snapped, what you need to do is just push it up, apply a little bit like so. You can brush it slightly down afterwards. You can leave it as that, but you only need a small amount because it will look really greasy otherwise. But that's a really effective way to make you not looking like you've got really massive sticking up hair. Okay. So I'll pop you one of those in as well. Let's check that. Okay, any questions? I know I've bombarded you with a lot, haven't I? But don't worry. What I will do is write this up ASAP. I'll have everything that I want you to do, instructions, recommendations, all sorts of things like that, what I prescribed you, etc. Okay, so it'll all be in there for you. All right, and your diagnosis and everything like that. Okay, yes, I will send you a copy to your doctor as well. All right, my lovely. Okay, and we're going to give this program a go and see what happens. Fingers crossed, think positive, don't get stressed about it, get plenty of sleep. Okay, yeah. Then all else fails, we can try obviously other treatments, and if that fails, then I recommend you potentially going to a dermatologist, seeing what they can offer you. And then you could always go down the route of other things. But I'm sure this is going to work. I have very effective results here, very high results, very positive. Yeah, exactly. But you need consistency, okay? It's important that you stick to it religiously and don't miss anything else out. Yep. Yet some people, you see, they start the treatment and they say they miss out the shampoo, or they've got to take the biotin, or, you know, they miss putting the spray on the head and things like that, and then they're wondering why it's not really having an effect. So it has to be consistent. Don't miss anything out. All right, my lovely. You're very welcome. Are you sure you've got nothing to ask me? Okay. So I'll send you to have a blood test, and I will get my lovely assistant to sort the products out for you. All right, and then I will email over your results to you with the bloods, okay? And if I want you to do something else, I will jot that in as well. Okay. You're very, very welcome, okay, my lovely. Now, don't worry, we'll get this sorted for you. All right. You take care now. Bye-bye.